Thank you. Well, we are now less than an hour away from the Maternal and Infant Health Summit. Our Holly Morris and Tisha Lewis have been out there all morning sharing a lot of really good information, useful information so far. Let's check in with them again. Hi there, Holly. Hi, Tisha. Good morning.
Good morning to you, and now we're happy that people are really starting to join us.
We're not alone anymore.
We're not. It's exciting as people are starting to fill in. The resource tables are starting to fill up, and there is really a lot of just good stuff that is going to go on today. Thanks to people like Dr. Tamika Auguste, who is with MedStar Health. She joins us this morning. And you know what I love about you? You have this gorgeous smile, but I see everyone walking around with really big smiles on their faces because this is such an amazing opportunity for all.
It is, absolutely is. Thank you for having me, and we are so excited here in the city. Everyone in the city is talking about it. All maternal health providers are talking about it. It's folks at MedStar Health to be here at the Mayor's 5th Maternal Infant Summit. That's fantastic. This is what was needed. This is what's great, and we continue to do it every year. This is fantastic.
And Dr. Auguste, I want to ask you, what advice do you have for mothers who are coming here today? I know so many times when we get in the doctor's office, we forget our questions or we get nervous about our questions. How can you help women and men find their voice and have a voice when it comes to their maternal health care?
Well, sure, absolutely. Well, I think the first thing is to recognize you have a voice. It's okay to ask questions, and please ask questions. Maternity care providers, we're expecting those questions. So go ahead. Nothing is too silly or anything like that. Ask about your medical care, but ask about things that perhaps aren't traditionally considered part of medical care. You know, what does postpartum depression look like? Am I at risk? Am I at risk for anything else? I'm not sure how to do this. How do I best get a pediatrician for my baby? How do I choose a pediatrician?
How do I get into the pediatrician? Because you can choose one. And then I found that really challenging.
Yeah. So have those conversations early with your obstetrical provider. Ask about, again, not just about your medical care, whether it's your blood pressure, your blood count, things like that, or what kind of delivery you desire, and make sure you voice your desires. It's very important. We want to hear that. We want to work together with you.
When someone comes in and it's their first pregnancy, what are the things, the internet's a great thing and it's a horrible thing, right? But what are the real things as a newly pregnant person that you need to be concerned about?
Sure. So one of the things is listen to that sixth sense. Pregnant women tend to have a little sixth sense there. And so if you're not feeling well, headache that won't go away with just plain Tylenol, or if you seem a little bit extra puffy, especially around the eyes, those may be some concerning signs, especially for something called preeclampsia. If you're not feeling well, or just, again, you have questions, don't hesitate to ask. The number of possibilities is endless, and the only way you're going to know is to reach out to your maternal provider and ask, hey, is this normal?
Dr. Auguste, I want to ask you, because so many women sometimes they do bring these concerns and questions to their doctor, and they feel like their voice is minimized. They feel like their concerns are not taken seriously. What would be your advice to those women?
Sure. So unfortunately, if you're in that situation, and hopefully you're early in your pregnancy, to have a sit down with that doctor and let them know, I didn't feel heard. Okay? And then depending on how that is responded, maybe it's time to find the right healthcare provider that suits your needs in terms of what you want. So, but again, the key here is don't be afraid to say, hey doc, last time I didn't really feel heard. Let's reset. Let's have that conversation to make sure that everyone's concerns are heard.
All right. Are you accepting new patients? No. This is the doctor that I want in my life, no matter what. Thank you so much. And you know what? She's one of the many fabulous people that are taking part in the summit today. It's in its 5th year. It gets stronger, bigger, better each and every year. All we need are people to come out and really take advantage.